Okay, so we're up to 18 who've joined. So welcome if you just joined today's session. I am recording the meeting today. So today's session we have Jo Stenning from Adur Health Partnership, who's a carers lead for the 4 surgeries within that partnership, and is going to be talking about her work, in particular talking about the health fair, which she was part of and I went along to back in March, and then some of the other work that she's actually doing and how she's recording the information. And then joining us a little bit later on, we'll have Julie Spedding, who is the operations manager for the PAP team, who will be giving you some information about their service and the support that they provide to carers and those that they're providing support and care to. So, Jo, are you okay to start with you first? I'll get the presentation up.
I'm fine. Yeah.
Okay, let's go for it. Can everyone see that? Is it loaded? Yeah.
It's thinking about it at the moment.
It's thinking about it. Okay.
Here we go. Doing its thing now. Oh, there we go. We've got it.
Oh, lovely. Well, I'm glad you can see it. It's still thinking about it at my end, but
shall I make a start?
Yeah, make a start, Jo, and hopefully it will sort of load from itself.
Okay. I'm Jo Stenning. I'm from Adur Health Partnership. I took on the care lead role last September. So I was just going to go through a couple of things, health fair, and then also a bi-monthly report that I do. The first thing is the health fair. We did this in March, and as Mike said, he attended as well. We had over 30 stalls in Shoreham. It was the Shoreham Community Centre we did it at one Saturday. And we had stalls from social prescribers, breast screening service and carer support West Sussex. But overall, we had 30 stalls and it was very well attended. We had over 650 patients attend. So it's very busy, particularly in the morning, wasn't it, Mike?
Yeah, very busy.
At there, you see the programme as well. So we did love to move taster sessions. So the patients, if they wanted to get involved, they could do a taster sessions of Tai Chi, dance, Zumba. We nearly got Mike up on the stage to do some mindfulness and Tai Chi. So the patients could join in at any point in those. And we also we had our first aid trainer who does CPR training for our staff who are non-clinicians. And he did basic CPR training as well throughout the day. So that was good. And as I say, we've received really good feedback and we're looking at doing it again probably next year. We had over 650 patients attend the sessions and we've had positive feedback from everyone, so that was really good. We had a guest appearance from Tom Rutland, who's our local MP. The next slide, please, Mike.
Yeah.
So this is some of the pictures from the day. As you can see, it was quite busy, and it was 650 was a guest, but I think we were probably over the 650 of patients that attended. And we got really good feedback. The next slide, please.
And it's us.
Oh, there you can see, there's us. We were there.
Yeah. We weren't allowed to move to get tea or coffee because it was quite busy. So it was just the traffic coming through was quite, there was lots, wasn't there, Jo?
There was, yeah. It was very busy.
Yeah.
It's hard to tell when you start something new of how busy it's going to be, and you hope people are going to turn up, but we were surprised how busy it really was.
Yeah.
So we've received really good feedback at it. So yeah, watch this space for next year. So AHP had 4 stalls at the health fair, and they did, one of them was group consultations. So we do group consultations for asthma, diabetes and menopause currently at the moment. So Those group consultations are run by a clinician, so it's either a GP, a nurse or a pharmacist. And we get up to about 8 or 10 patients in who agree to have a group consultation, who want to attend those in, and that's how we run them at the moment. We're looking at expanding those because they are proving to be quite popular. We also had a Green Health MOT stall, which was our green team were there explaining what Adur Health do to reduce our carbon footprint, but also we were looking for inhaler swaps from the aerosol to the powder. So they were doing that at the same time there as well, because we did this last year, we did a massive swap for the patients, but we were also collecting people that couldn't make those sessions. And the collaborative practice, we had a stall there for that. So this is a slide that you will see. We have what we call practice champions, who are patients who volunteer their time to run collaborative practice free and fun activities. So we do, as you will see there, coffee mornings for patients, which are very popular, and they move around all of our 4 sites. We've just started up airways for patients who have COPD, because singing is meant to be really good for any respiratory issues, and that is proving to be very popular as well. Tai Chi we've just started, and we give them a block of 6, just as a taster of Tai Chi, and then if they want to carry on, they can look locally of where they can go and carry on with the Tai Chi for people who've got balance problems or mobility problems. We do a walk and talk every Wednesday, which is very popular. We have a lot of patients come in and then they go off and do their walk and talk and go for cups of coffee afterwards. And that's for all levels, so you don't have to be a really fit person to do loads of walking. It's just a walk and chat, really, particularly for people who live on their own. We find that one really popular. And Crafty Cuppa, that's been going a couple of years. That's very popular. It moves around all 4 sites, and we get a lot of patients dip in and dip out of those. But all of these activities are free and run by our practice champions, who are volunteers, and we get really good feedback. Next slide, please. So this is the second part. It's the bi-monthly report that I decided to do when I started last September. So I just do a spreadsheet which captures all the information in one place. So we've got 4 different locations, and we've currently got over 37,000 patients that we look after. And we merged 3 surgeries together to become Adur Health Partnership. So a lot of the data needed sanitising, and it hadn't been looked at for a couple of years, particularly through COVID, and then we were doing the merger. So there's been quite a lot of time spent on sanitising the patients that are coded as carers. So we're now up to 71% as of end of March of our patients we've reviewed. We've increased our registrations with Carer Support West Sussex since we've taken it on. I think you've probably seen that, Mike, haven't you?
Yeah.
Our numbers have gone up. And the one thing that the 2 people who receive this is my GP, who's the lead for carers, and the director, and they like everything because it's all in one place. So if they ever got asked any information, it's all on one spreadsheet. So that's the first tab. The second tab, next slide please, is just the quality markers. I know these are being updated, but I've just brought across the quality markers and their current details, and then I've just brainstormed of what we have done, because over the last few years it's quite easy to forget how much you have done. So we've just started documenting that, and we'll wait and see when the new quality markers come out. Next slide please. And then this is the third tab. It's like a Gantt chart, because it's very easy to forget when you're updating things or doing things or introducing new things. If you think back over the last year of what have we done, I thought it'd it's quite a good idea just to do it's a bi-monthly report. So I just review this every bi-monthly, just go through and say, well, have we updated the carers board and the digi boards, because we didn't have them in September last year. And it's just a Gantt chart just to say, yes, we have reviewed them. And if anyone comes in to do an inspection, it's quite easy information to give someone, and then they can see what we're working at the moment. And it just lists things like identifications of carers policies been updated and it's been communicated to all staff. And carers coffee morning, which we're doing for carers week in June, which is your next slide, please, Mike. So to celebrate carers week in June, we're doing a carers coffee morning, which is our first coffee morning that we've set up. And we've got different organisations attending. Carer Support will be there, as well as like Dementia Hive, who are locally opening up a new one in Lancing. So we've invited all our unpaid carers in. We're going to see how it goes, but looking to probably roll these out every month or bi-monthly. So that will be interesting. But yeah, we want to celebrate Carers Week. And so we're doing this for the unpaid carers, and they can bring the people they're caring for with them as well. And for our staff, we're just doing a refresher leaflet about carers, what codes to use, who to contact if you've got any queries with internally, and just useful information for them. And that's my presentation. I hope you found that useful.
No, that was really sort of useful. I like sort of like how you're sort of recording the information, and with the bi-monthly sort of reports. So is that what you use, sort of like, I think you said, sort of feeding back sort of like to your managers,
Yeah,
sort of like your progress? What would you say was one of the biggest challenges, Jo, sort of when you took over in September last year?
I would say the data, because there were 3 different surgeries, so they were recording things differently, and not all the codes were being used correctly. So it's going through that data. But once you've sanitised that, you've then got confidence in who you're texting out and who you have got recorded as your carers, your unpaid carers.
And going back to the beginning of your presentation, sort of, I mean, the size of that health fair that you had sort of back in March, how much sort of planning sort of went into that?
That was my manager was involved in planning that for over 6 to 8 months before, getting everything together, getting the rooms together, what are we going to do, the different sessions, the taster sessions, getting those ready, and brainstorming with some of our patients who are members of the PEG, the Patients Engagement Group, brainstorming with them as well, as a patient, what would you like to see? So they were very involved as well.
So yeah, your old PEG is it's the PPG, isn't it? Sort of,
yeah.
But I remember sort of when I sort of came to speak to them, I think it was last year, early part of last year. And I think I'm coming on the end of June.
June.
Yeah, sort of to speak to them. Has anyone got any questions or anything they sort of wanted to ask Jo about? No?
Mike, I don't have oh, let Isla go first.
Isla?
Oh, sorry, it takes me a minute with the mic. Hi, yeah, oh, it's amazing. I know Amanda went along to that to help, but it's just really good to hear how successful it was. I guess I'm really curious because I do signpost to some of these groups when I get the kind of ADA patients, and I just wondered which ones are the most kind of, maybe not even popular, but which do you feel are the most kind of, that have been most helpful, or you've seen the most kind of positive feedback about? I'm just really curious.
What, from the schools?
Not from from the actual groups that you're running. So the with like the Tai Chi and the choir and things like that.
The walk and talk is very popular, and we receive a lot of good information back and good feedback from that. And that is probably the biggest group that have come out. There's about 45 patients on our list that appear they can drop in and out of those. So that's probably the biggest one that we do.
Oh wow.
So we're starting them up a mindful movement one for people that have got chronic pain. And I think that one's going to be very popular. We've texted out to patients who would come into that category, and we're getting a lot of feedback on that. So I think that's going to be a popular one as well.
I thought, oh, wonderful. It's such a missing area for people, and what a lovely thing to do. Oh, thank you so much, Jo.
I think they like it because some people are on their own as well. When we went to the fair, we were getting a lot of people come up to us and say, actually, I am on my own. It'd be quite nice to go on a walk and talk. It's not like a run or anything, is it? No. It's gentle. You can drop in and out as you want. So, yeah, it's getting people together as well, socialising if they do live on their own.
Yeah, absolutely. Really essential. Oh, thank you.
Anna.
Thank you. Couple of things. Jo, firstly, looks like you've done incredible work, and I'd just be interested to know, I mean, I'm a person that loves a report, as Caroline and Mike will know, and I love stats and things that show the evidence of the work that's being done. How difficult or easy is it to set up a report like that so that others have, might be able to do similar if they would find that useful?
I found it quite easy because I'm just adding to it every couple of months. So as I'm doing things through that month, I found it quite easy just to record it, because you do easily forget what you're doing.
Yeah.
Things that you've done, and you just want to prove that this is what we're doing. If anyone comes in, if anyone wants to do an inspection, this is what we've done over the months.
Yeah.
So
and I suppose it helps keep you on track as well, doesn't it?
Yeah. And it's easy
and with
as well,
that first report that you showed, have you extracted that information off of your systems, or have you had to manually do that one? That first.
Yeah, the one with all the statistics.
Yeah.
I've had to run reports in EMIS to give them those figures.
Yeah. And then it's a manual report.
Manual calculation.
Cool.
Yeah.
Thank you. And then just to let people know, many of you will have had Mike and Caroline come out and do a baseline review with you. I'm just going to quickly show you what the baseline review paperwork looks like, because Jo just showed everybody how she's thinking about the Care Quality Commission's quality markers, which, as she said, are being reviewed at the moment. We've actually, which is very nice, but we've been approached as an example of best practice for that, and all of the work that we've all undertaken together around two areas, both the carers register, and then how that leads to increased health support. So I just wanted to flag for all of you who have had a baseline review with us, this is what it looks like. And all of these areas map across, not directly because we set up the pillars, but they're all entirely covered within the Care Quality Commission's current quality markers for supporting carers. And if you've done any of this work with Caroline and Mike, they can actually pop you together. Excuse me, I've got 1,000 things open. Let me just see where it is. They can pop together this for you, which you can add to your folder of evidence for the Care Quality Commission. So it just says, thank you for working with us to improve care identification and support. And we basically delete off the areas that perhaps you haven't done yet, but it incorporates all of those areas that you have done. And as I say, they do all map across to the work that's in the Care Quality markers for carers. In fact, if you're doing this with us, you'll probably be ticking off something within all of the areas, if not more than what's happening in the care quality markers. So that's just for you all to be aware of, because obviously, whilst all of you that have been involved in this work have seen the benefit for your patients and for your surgeries, it is also something that the Care Quality Commission can and do ask about in there when they come and inspect the surgery. So you can just have this within your portfolio of evidence to just show exactly as Jo is, Jo's got a really wonderful comprehensive report, but for those that perhaps haven't got all of that yet, we can supply some of this for you if you've done that baseline review work with us. So it's just kind of flagging with you that is there, and that is something we can help you with. And that is totally inspired, I didn't plan to share that with you, by Jo's fabulous work. So thank you, Jo, for sharing that with us.
That's okay. I've actually added, because I've got our one back from Mike, I've actually added that on our tab 4, so
Yeah,
it's all in one place. Yeah,
fabulous.
thank you.
Thank
No,
you.
thank you, Jo. I just want to thank you for actually sort of coming in, and because it's Jo's day off, but she sort of decided to sort of come in today and do the presentation. So that was really kind of you to spare your time with us.
Oh no, that's fine. Thank you.
Okay. So we're going to be joined. I think Julie's actually arrived. We've got Julie Spedding from the PAT team. Julie, are you there?
I am here, Mike.
Hey, that's good. It's a bit like the Eurovision, isn't it? So call in
Milk one.
Luxembourg.
Yeah.
Are you happy for me to share your presentation?
Absolutely. You're going to be my Debbie McGee, are you?
I am, yes.
And I think, having heard what I was just hearing, I've got a hard act to follow.
No, you'll be fine. You'll be fine.
So you're
Right.
happy for me to just start, Mike? Is that okay?
Absolutely. I'm just going to share the presentation.
Okay, that's lovely. Just to say thank you very much for inviting me along to your meeting. I'm actually working from home today and I'm in my loft, and I've just had to run downstairs and put a pair of shoes on because it just didn't feel comfortable giving a presentation in my slippers. So I'm trying to be as professional as I possibly can this morning. Can we go to the next slide, please, Mike?
Yeah, I apologise. It's even my internet, but it's very slow.
That's okay.
It should actually. Here we go.
My excuse is my age. That's why I'm so slow.
That's my excuse as well.
I don't know how many of you know about the prevention assessment team, so I might be telling you information that you're already aware of. So basically, we are an MDT, a multidisciplinary team that we share a common goal and vision. And in a nutshell, that goal and vision is to keep people safe, well, and independent in their own homes. So that's sort of a bit of a nutshell to what we do. As part of our multidisciplinary team, we have workers from West Sussex County Council. So the service manager, the 3 operational managers, of which I am one, and we also have community prevention officers. They are all funded via West Sussex County Council. We also commission in services from Sussex County NHS Foundation Trust. So we have qualified nurse advisors that sit within our team. So we have one senior nurse, and then we have various other nurses across our team to actually do the on the ground work. And we are commissioning Age UK as well, where they give us community support workers to help us understand and work much better with the voluntary sector. I've been with the prevention assessment team for 17 years. 17 years now, since 2017. And I was due to retire last year. I love the work and the team so much, I decided not to go. I just wanted to throw that in there because I feel what we do is so valuable. Can we go on to the next slide, please, yeah. Mike? So what do we do? The key thing we do is we give people a holistic health and social care assessment. We focus very, very much on a strengths-based way of working. So adult social care, as was, used to be very deficit-led, and it would be very much asking people what they couldn't do. Now we're much more into saying to people, what is it? What can you do? What can your family and friends do? And then outside of that, what can the wider community do to help you meet the outcomes that you want to meet? So there's been a lot of work in trying to make people think in a different way, staff think in a different way. As a prevention assessment team, we've never had a budget that sits with us. So we've always been quite strengths-based in the way we approach people. For my adult social care colleagues, I think it's been slightly more difficult to change that mindset of what can't you do to what can you do, but they are coming on in leaps and bounds, I have to say. What we do is we provide information and advice to people. Can I just say I hate the word customer. We've popped it in there, but I don't like the word customer. They're just people, their families and other professionals about what's out in their community. I don't know if any of you have access to Clio 3 at the moment or are aware of Clio 3. It's a database of community services that's run by our library service. And we're trying to encourage people to use it as the main depository of information, community information. So we have one version of the truth. What's really, really good about it is they have staff that keep it updated. So it's an ongoing evolving database. So if you haven't got it, what I will do is I'll send Mike the details of the email that you need to go to get access to it. And the library staff will also give you training, which is always a bonus, I think. And we work with people to get the practical and an emotional support they need. Where we put from end-to-end working and casework, it's very much about working at the person's pace. It's no good us inundating people with loads and loads of information all in one hit. We will try and work with people to do it at their rate, their pace. We're not support workers, I'll just make that clear. We're very, very much there to provide information, guidance, referral and signposting to help people to remain independent. The sort of star attraction about our team is our nurse advisors, because they can offer us a much focused advice and information service. So Mike, if you could go on to the next slide, that would be lovely. You'll have to bear with me, I've got notes next to me because I can talk for England, but I do tend to forget things. So the criteria for accessing our service is for those over aged 18. Now, I will be honest with you, the majority of the people that we get coming through to us are in the older bracket. I would suggest 55 plus, and that's something we're really, really trying to work on to make our service much more accessible to everybody in the community rather than just those of an older generation. We want people to be able to act on the information and guidance we provide, or they have someone in their network who can. What we really want to do is empower and enable people. We want to give them what they need to do rather than do it for them. So when we talk to people, very often we do get carers coming to us, which is absolutely fabulous, and we give them a lot of information to support them with their person they're caring for. So we don't always use the cared for as our customer. Quite often it is the carer who comes to us. Able to meaningfully participate in the process is really, really important because, as I said earlier, we operate in a very strengths-based way. So we need to have that person's interaction with us. We need to understand what's important to them. I'm sure you've all been in the same situations where families say one thing and the person says something else, but we try really hard to keep the person at the centre of all the work that we're doing. And it's also about being able to benefit from our offer. So we are not social workers. We are there to provide information, signposting and guidance. If people do have care needs, i.e. they need practical help, they're not for us. Our role is very much that prevention, the prevent, reduce, delay agenda within the Care Act. So we're there to stop people needing those higher intensity services. Next slide, please, Mike. I nearly called you Debbie then, as in Debbie McGee, sorry. I was going to say a little more about the health prevention offer. So we have, as I say, the trained nurses in our team, and they provide a sort of two-pronged approach to what they deliver with us. So they work directly with us operationally, and then they also offer health checks out in the community. So if I tell you a little first about how they support us in our operational on the ground work. So we will identify through the work we're doing where people haven't seen their GP for a long period of time. And we then ask the nurses to come in with us and support us in understanding what's going on for them health-wise. About 1.5 years, 2 years ago, our nurses actually decided to go back into uniform to work within the PAT team. So before they'd be in mufti, like the rest of us, but actually they made the decision to go back into their uniform. And this has been absolutely fantastic when we're going out into people's homes, talking to people. I think there's some sort of a trust thing in seeing someone official in a uniform, that type of thing. So that's been something that we've learnt and sort of acted upon. They do work with people who've had recent falls, so they don't take over from the falls team. but they can work with people who have fallen, and it's the big thing is about the fear of falling. We have a lot of older people who come to us, they haven't actually had a fall as yet, but they are quite worried about that. So the nurses will work with them again, as I said before, at their own pace to look at what potentially could be put in place and how the nurses can help and assist across their medical conditions as well as the falls. They've also give information to people, as it says here, about supporting them with their own health condition. I found it quite shocking the number of people who struggle sometimes to engage with their GP for whatever reason. I can't always tell, but having a nurse going in and talking to them directly has proved a benefit. But the nurses would always try and encourage them to get in contact with their own GP. We're not a service to overtake what a GP does. We're trying to complement what a GP does and encourage them back into their health service. Next slide, please, Mike. So the other part they do is they offer health checks in the community. So as you can see there, the criteria is for people aged between 40 and 70, but it needs to be where they don't have, and I had to get this right, where they don't have take statins or blood pressure tablets, or if they've had a heart attack or a stroke, they won't be eligible. But basically the nurses go into the community in various settings. Sometimes it's GP surgeries, sometimes it's libraries. To be honest, it's wherever there is a need, and they are always looking at what their waiting lists are. So if waiting lists are large, they will try and find another opportunity location within that area to try and make sure they're seeing people as quickly and efficiently as they can. So they do blood pressure and the atrial fibrillation clinics, which is great. They took my blood pressure once and they won't take it anymore. So they told me I had to go straight to the GP. So they're very good at telling you what you need to do. If they are finding people are having blood pressure issues, etc., they will inform the GP and encourage the person to go to their GP. So as again, targeted events for hypertension and arrhythmias. They do a lot of health promotion in line with the sort of health promotion calendar. So recently they've been doing work on the sun screening type of things, and they've been in the one that I know about was at local Tesco's. They were out there giving people information and advice about the sun. And they do as well give educational sessions for local community groups. So for example, one of my nurse colleagues goes into one of the pubs in Worthing, and I can't for the life of me think which one it is, and that's awful, but I know they did a talk about diabetes in there to try and help and support, because quite a few people had sort of shared from that meeting they had diabetes. So they did an overarching conversation with them, giving them a bit more information about how to manage it. Next slide, please, Mike. So, community-led support. Where we sit at the moment within West Sussex County Council, we are getting referrals, and I'll talk a little bit more about our referral sources in a moment, but we tend to be getting our referrals from people who have already contacted the County Council. We do get self-referrals, but what we're tending to get is people who are phoning West Sussex County Council and then they're coming to us. Now, we are a preventative offer. So what we are trying to do is we're moving the team out into the community, actually embedding them in the community, so they can hopefully try and get to people earlier so that they, excuse me, so they can then prevent people from picking up the phone to contact West Sussex County Council. So it's we're very early in the stages. We've labelled it community-led support, but actually everybody, any agency, any service in the community is delivering under that approach anyway. It is just the way we're all working at the moment. What we're trying to aim to do is to give people information and advice where they need it, when they need it. So it's about us being much more proactive in getting out to people, talking to them at the earliest point. We're doing a lot of promotion around PAT as well with colleagues, professionals, but also in the community, because people might not need our service at the moment, but they might in the future. one of the things that we're really, really keen to do is we want to complement existing services. There's fantastic work already going on out there. We just want to be equal partners in that. We just want to see what can we put our prevention offer into what everybody else is delivering, rather than us doing a usual West Sussex County Council approach of we're coming in, we're going to do this, we're going to do that. We want to look at what's there and understand it and work with it. We're all out there to build resilient communities. We just want to be an equal partner in that. One of the things that we are doing, and it has been quite interesting, is we've been piloting some work, and we put in there about helping people understand adult social care, and we'd put that in the sort of brief for the staff to be more around members of the public. But what has been really interesting for us is supporting other organisations in knowing what adult social care do, but more importantly what adult social care don't do, and also the pathways into adult social care. So that's been a really interesting lesson for us. So next slide please, Mike. So we get our referrals from CarePoint. So CarePoint is our first point of contact within West Sussex County Council. So people will phone in, they'll go through CarePoint, and then CarePoint will pass eligible referrals into us. We get a lot from adult social care. So where people have gone to what we call a community team, so it could be I'm going to use the normal bog standard community team, or it could be our lifelong services for people with a disability, or it could be our ROVI team, where people are coming to them where it's recognised actually they don't have care needs, but actually they would benefit from information and advice for them to be enabled and empowered to do work. They will come to us. So just going back slightly, where we were talking about our role is about giving people information and advice, and they need to be able to act on it. Where people do have care needs, as I said before, they shouldn't come to us. Where you may be coming across people where they actually have a need for some physical, actual practical support, that will need to go through CarePoint, because they then contact the person, get the full story, and then pass it in the majority of times to adult social care. We do get self-referrals coming through, and one of the things we want to do by us being much more out in the community is to see a big increase in those self-referrals. So it will demonstrate that actually we're getting to people before they actually contact West Sussex County Council or housing or health. We're out there in the community giving them what they need at the first point. What we also want to do is support other professionals in knowing what's out in the community. Hence why I sort of mentioned about Clio, that type of thing, because it's a system we can all access and we'll all be giving the same type of information. Something else that's just sprung into my mind, and I should have mentioned it, when we're doing the sort of holistic assessments that I talked about earlier around health and social care, we as a team can prescribe small pieces of equipment as well, rather than things have to be siphoned off to occupational therapists. So we can prescribe things such as chair raisers, trolleys, I'm trying to think what else, the toilet raisers, that type of thing. So if when we're doing the assessment, trying to find out what people want to achieve, and something like that is missing from them and it would help them stay independent, we can do that. If we're assessing somebody with our health and social care hat on, and actually the needs cannot be met by an information and advice service like ourselves, and it comes to like the person does have eligible needs, we can then get them to the right community team to be getting the right service that they require. So I just wanted to add that bit there. Next slide, please, Mike. And there are numbers. So we are the prevention assessment team. We have a gateway. So that number goes into our gateway where you will get hold of a member of staff who can either offer you professional to professional advice for you to support your own customer. That's our preferred option. We really like to provide that to support you doing your work. If we're getting people coming through that we need to talk to, individual customers, Gateway will phone the customer, have a good conversation with them, see what we can offer at that first point of call. And if they need more help and support, they'll be offered a visit for one of the team to go out into their home to talk to them. We do get a lot of people coming to us where they have lost control of their environment and their homes are quite hoarded and cluttered. And we seem to have been badged with a bit of a specialist sort of team on doing that. Please don't think we are at all. But we will go out and visit somebody's home if they will let us, to see what we can see once we're into their home. We'll work with them to see what they need, how we can take things forward. And there's our also our email address where you can come through to there. And I think that's the last slide, Mike, is it?
That is, yeah. Yep.
There you go.
Well
I'm
done.
sorry, I really can talk for England, so my apologies. If any of you have any questions or comments, I will do what I can to answer.
Leslie was just asking in the chat, she just said if you had a list of the sort of low-level equipment that you're likely to be able to supply.
Yep, but what I will say, we won't accept referrals just where people need low-level equipment. So it would need to be part of us doing a wider assessment with them in understanding what it is that they need to achieve. And then if the equipment will help them, we will then do it. We're not an equipment team, if that makes sense, Leslie. But of course, I will get a list for you and I'll pass it on to you, Mike.
Okay, lovely. Thank you.
Yeah.
Anyone, any more questions?
Well, that was easy.
Yeah, that was. That was very easy. Well, thank you. Thank you so much,
No
Julie.
problem. Thank you very much for inviting me.
You're very welcome. That was really good for me as well, sort of like to understand. I know we met a couple of weeks ago, but to sort of understand more as well. Oh, okay. We've got a question from, let's have a look. From Fiona. Julie, what team should I contact about hoarding cases?
If you are working with a hoarder, in the first instance, I would suggest you always, I don't know, have you had access to a document, and we call it the Safe and Habitable Homes Toolkit. I don't know if you have access to that. It's something a colleague of mine called Camilla O'Brennan put together, and it's a step-by-step guide of how to go through and support people with hoarding in line with the safeguarding and self-neglect policy. And it's a really good, helpful guide where it says, these are the questions you need to ask. This is the clutter rating diagram. This is when you need to raise a safeguarding, etc., etc. Would it help if I sent that out to you as well? I'll just make a note. So what I would suggest in the first instance is you go through to CarePoint, who will then hopefully will then contact the person to try and get a bit more information about why is it they cannot clear the property themselves. So that's quite a key question to ask. Obviously, you'll need to get consent from the person to refer them into adult social care, into the prevention assessment team, wherever you're going to refer them. So they will then work with the person to understand, is it an issue where actually they need some more practical care and support, i.e. they need a package of care, or is it something that can be dealt with via information and advice? In the main, the majority of people who are hoarding will tend to have eligible need under the Care Act. And this could be because they are either physically or mentally unable to do the tasks needed to keep their property clear. Adult social care does not fund cleaning, so I'll just say that from the offset, but my advice would be go through to CarePoint 2, refer it into there, then they will do the triage conversation and then siphon it to the right part of West Sussex County Council. Hoarding is an incredibly difficult thing to deal with because it's so complex. But if I send you this guide, it might help you to start thinking about potentially what you could start doing, because more information you can give will help with taking it forward.
That's brilliant. Leslie had a question about, oops, sorry. So
thank you.
No problem.
How can we help support you within the surgeries? And do you want time to come and talk to patients?
Well, that is one of the things that we're looking at. So at the moment, we are dividing the team up into sort of, we're going to be coterminous with district and borough councils where possible. So we're just getting a little mini team set up across county. I'm hoping some of you have already met some of the PAT workers either directly or at other events. So what I will do is I will send to Mike as well a list of who the workers are in each of the areas, and if you can connect with them or they can connect with you, we can then look at actually what's the best way to do things in each community. Each community is different, we're finding that, and I'm sure you all know that. So we're trying to make sure that we are working very closely with health. Issue we've got at the moment is community-led support is absolutely our direction of travel, but because we're getting referrals in from all the other sources that I showed you, we're at a bit of a seesaw moment at the moment where we're trying to release staff to go out into the community to avoid people picking the phone up, but then we're also dealing with currently the people who have picked the phone up who are coming our way. So we have quite limited hours on community-led support at the moment, but we will be changing that. But if I give you the details, please make contact with the community prevention officer that is fit for your area. So this is this Ada and Worthing?
No,
Or is this
all over the
county-wide?
county-wide,
Brilliant.
yeah.
So if I send you the list of all of them, then at least you've got somebody to add a contact. Is that okay?
Yeah, that'd be perfect.
Okay.
Thank you.
But you've also got my name now as well. So if you ever want to just discuss something more, Mike, I'll give you my direct line number. I'm leading on the community-led support project. So if ever you have any comments or you just like to talk a bit more about joint working, please give me a call and we'll arrange a time to meet.
Brilliant.
Thank you so much. Thank you for letting me come to your meeting.
No, really appreciate it. Thank you for your time.
Hopefully meet some of you soon. Take care.
Okay.
Bye. Bye.
Bye. Wow. That was really good. I really enjoyed that. Can I pass you over to Anna now? Anna, if you'd like to have your spot.
Yeah, we're whistling through today, everybody.
We are.
Sorry, I might keep coughing, so just hold a sec. I just wanted to flag a couple of resources that we've put together for you in case you would like to use them, and we'll circulate them directly after this meeting. So the first one is to share my screen with my 1,000 things open. Is this one. So Carers Week is only 2.5 weeks away, and every year we put together just a mini pack of resources or activities or links for you all in case you want to do anything for Carers Week. So I'm just going to quickly run you through so that you can see how to use it. It's not rocket science, but if I show you some of the things that are in here, then it might prompt your interest and you'll look out for it after today's call. And plus you can ask me any questions. So it just goes through the information on what Carers Week is, and then our ask, which is to raise awareness with patients and staff in Carers Week. So I've linked here in case anybody asks, or in case you want to inform your reception staff or anyone that might be having conversations with carers. I've just linked through to our general information because we have got a wealth of events taking place that week, all of which are free to carers, and they can all book on in advance. So you can see there's keep clicking, there's more and more and more that are taking place in that week, and they range from informational events and activities that just bring people together to have a bit of a break on it during Carers Week. So I've linked through to that page within the document so that you can have a little look, see what's happening in proximity to your GP surgery, but also, you know, some people might want to travel for a day at Leonardsley or for a special opportunity that will be taking place in that week. I know many of you do have increased your online socials, so we have put together both local and national, depending on what your preferences are, but some social media posts for you there. So those are referred to more than our service in some instances, the health team and young carers family service. It actually references those events we just mentioned, so you could just do a socials on it to let them know how to link through. And then we've put some of the Carers Week national posts on there as well as the links to the resources that they've produced for everybody to use in Carers Week. We've shown you this one before, but for those of you that do proactively use just pause it for a second. For those of you that do proactively use your digiboards, I think this is actually a really nice a nice little animation for you to have, occasionally showing, or perhaps during this week, when it will raise awareness to carers of some of the support they can receive. It's only a couple of minutes long, so I'm just going to play it for you now. I'm not sure did anyone hear the sound? No, let me just share with sound. Hold a sec. Share, include sound. Screen. Can you see, Caroline and Mike? Can you tell me if you can see? Yeah, okay.
Yeah.
Your rights as an unpaid carer can make all the difference. A carer is anyone who provides unpaid care and support to someone with an illness, disability, mental health condition, or addiction. Here are 7 rights you are entitled to. 1. The right to identify as a carer. Your GP can identify you as a carer on your patient record, which may put you in a priority group for vaccines and other public health campaigns. 2. The right to a carer's assessment. This will offer you support and assistance when caring, which helps make your life that little bit easier. 3. The right to being consulted during hospital discharge. If you are a carer and you're cared for is being discharged from hospital, the hospital must identify and consult with you where possible. 4. The right to a free flu jab. Carers in receipt of carer's allowance, or those who are the main carer of an elderly or disabled person, should be offered a free flu jab. 5. The right to unpaid leave from your employment. In 2024, a law was passed giving working carers the legal right to up to 5 days unpaid leave per annum. 6. The right to flexible working. You can ask your employer for changes to your working hours, times of work, or place of work from day 1, with the right to amend this twice a year. 7. The right to protection against harassment or discrimination. If you look after an older or disabled person, the law, Equality Act 2010, protects you against direct discrimination or harassment because of your caring responsibilities. Being a carer is a challenging but rewarding role. Knowing your rights can make sure you get the support you need to continue caring with confidence.
Okay, so that's held within the document and links you through to it here. So again, it might be something you want to use in your socials or on your digiboards. We've linked through to the digiboard posters. You'll have seen these before, but we've populated them there. This one will be attached to the email because we haven't actually put this onto the primary care website, but many of you know that we've, Mike and Caroline and Sammy, who's actually on this call with us today, are increasing reach and information to carers about what support they could get related to their energy. And this particularly matters in, seasonal extremes. So in very hot summers, even more particularly in very cold winters when it poses considerable risks, especially to those with respiratory problems. So that will be attached to this email, and it looks like this. So that will be there as well. So again, you could decide if you wanted to print that out and add it to your notice board, or to use it as a digital poster. And again, for those of you that prefer or would like to incorporate the national posters, we've added those there. I think it's 4 that they've produced for this year. And we've linked you through to the text message campaign. I mean, Jo today talked extensively about her register. We know that many of you have undertaken a lot of work, time and energy, but seen the benefits of it, of reviewing your carers' registers. And this links you through to the text messaging campaign. the how-to essentially of how to do that, which is on our toolkit. It's taking a while because I've got so many things open, but it does link you through to that, and it's an opportunity to think about how to use your system. You can use, if you've got you can use a Florey questionnaire on Accurex if that's what you use, but the kind of questions you could ask to update your register, and Caroline, myself and Mike will all be available if you want to talk any of that through. And keep going, nearly there. Some key messages for your staff. So I don't know if any of you do a weekly update for staff, or if you're, you know, the person leading your organisation does any messages out for staff at key points in the calendar, but we've just popped together some key messages for Carers Week that you could think about sharing with your staff. And then at the bottom, we've just added, you'll have seen these before, some images that you might want to use again in your socials. So that's all been popped together for Carers Week. And it's in 2.5 weeks, so not too far away for you to be able to think about what you'd like to get ready. And Caroline and Mike and myself, Caroline and I are actually both off next week, but we're here if you want to talk or any of that through in the lead up to Carers Week. And I know Caroline and Mike are kind of doing different activities with some of you as well. Does anybody have any questions on that activity pack? Nope, fabulous. Okay, what I will just want to say to you as well is I just referenced the energy project there. We were funded, as you all know, to do our primary care engagement work from 2023 through to the end of March of this year. We've been really fortunate that we have been able to extend this work for another 18 months, but it is on a slightly more limited basis. So these meetings will continue. We think they're invaluable and a great opportunity for people to come together and to keep the conversations going. And Caroline and Mike are still available to come out and to do some of that baseline review work with you. We're just, in terms of our capacity, we're also just doing the energy work, but we're trying to look at ways to actually integrate that, because we think it's invaluable to reach out to the most vulnerable carers when we're doing that work, because obviously those with health conditions themselves, or those supporting people with particularly long-term or respiratory conditions, will be most affected during seasonal extreme temperatures. So we are looking at thinking about how we can integrate that work together. But it's just to kind of acknowledge that the wonderful project as was has come to an end, and hopefully none of you have noticed too much that we have moved into a new phase of this work, which does last for another 18 months. So if anyone does have any questions for us about that, then just get in contact with us. But Caroline and Mike are still out there doing the baseline reviews. Many of you I know have received the stickers and the badges. And I think it's really helpful to think about that Care Quality Commission evidence checklist that we can support you with producing if you've done some work with us. And that is everything from me, unless you'd like to ask me any questions. Okay, I'm going to hand back over to Mike. Thanks, Mike.
Thanks, Anna. Well, it seems like a really short meeting today. We went for an hour, but if you've got anything that you need to ask us, or you think that you want to ask us sort of after, please send us an email or get in touch, however you sort of need to get in touch with us. I will be sending the sort of slides and sort of presentations with a follow-up email with the links for Carers Week information. I shall try and get that done this afternoon. And I'll also be looking at the next day of our next Carers Bleed Learning Network meeting. So unless you've got anything you wanted to ask, just wanted to say thank you for coming along today. And I hope you found it useful. What I will be doing is in the follow-up email, because I haven't sort of prepared anything now, I'm just going to attach a quick poll just to sort of see if you found it useful sort of with the information today. So if you wouldn't mind sort of clicking on the link for that when the email comes through this afternoon. Okay.
And also, Mike, before people leave, we want to keep these, you know, the subject and the themes of these meetings as useful and relevant as possible. So if you could just drop in the comments, the chats before you depart, if there's anything that you would like particular speakers on, or themes that you would like us to explore, can you please pop it in there? Even if it's something, I mean, we've been doing these now for a year and a half, so we could revisit some of the topics that we've spoken about in the past. But if you could just drop for us, because we keep trying to find new areas of interest, but some of you might appreciate refreshers, or some of you might have particular issues that are presenting themselves in your surgeries that we're not particularly aware of. So please do, if you've got anything you would like us to explore by way of speakers in the future or topics in the future, please drop it into the chat so we can pursue that for you. Okay, thanks everybody.
Lovely, thank you. See you all again soon.